everyone, my name is Isolde Fernandez. I'm from Section 3B. Today, I want to talk about the importance of tracheostomy care. So first things first, what exactly the tracheostomy? Think of as a tiny opening with surgically on the front of the neck. So here siya, which leads air go directly into the white pip or trachea. This is usually done when someone can breathe properly through their nose or mouth for some reason. So instead of breathing the normal way, they breathe through this hole with the help of the tube. So why do people need this? So people might need a tracheostomy for various reasons. Maybe they have a serious illness, injury, or blockage in their throat, or they might need help breathing for a long time. This is also thought, but the part is that with proper care, people with tracheostomy scans live normal, healthy life. So I'll show here image here po. I show here an image. Just imagine this bottle is a person neck. When the normal airway is blocked, doctor make an opening here sa kanang naigod tracheostomy tube, just like this small hole, to help them breathe directly through a tube. So this simple model here show how air can pass through a tracheostomy tube. So the importance of tracheostomy care. So now, caring for a tracheostomy is super important. So why? Because if the tube get blocked or infected, it can cause serious breathing problems. So taking care of it properly, keep everything clean and safe. So the case tip in tracheostomy care. So what does tracheostomy care involves? Here some simple but crucial step anyone should know. First step is the cleaning the area. The skin around the trunk opening needs to be cleaned gently every day to avoid infections. You use sterile water and a thin cloths or cotton swab. The second is the changing the tie or the strap. The tube is held in the place by a tie or strap around the neck. These should be checked and changed regularly to make sure it's not too tight or too loose. Comfort and safety are both key. So the third is suctioning the tube. Sometimes mucus build up inside the tube, making it hard to breathe. So suctioning removes this mucus to keep the airway clear. It's need to be done carefully and hygienically. And the fourth is humidifying the air, because air is coming directly through the tube. It can dry out the throat and lungs. Using a humidifier as moisture and prevent irritations. And 5 is watching for sign of trouble. It's super important to keep an eye out for site of infection like redness, swelling, or any unusual smell. Also, any difficult breathing or changes in voice must be reported immediately. So I will show here again some clip or image in this side. I'll show how you would gently clean around the trunk site using the cotton onward motion and gentle stroke. So just like this, the area around the trunk need gently cleaning every day to prevent infection. It's simple but very important for keeping the patient safe. And so imagine the straw is the suction tube, and the tissue is the mucus. So how suctioning remove mucus? By pretending to suck the tissue from the cup using the straw. So here are the image. Sometimes mucus block the airway, just like this tissue here. Suctioning helps remove it, keeping the airway clear so that the person can breathe easily. So imagine this is the humidifier. Here na image dire or video na ipakita na ako dire sa kilid. Since air goes directly into our lungs through the trunk, it can get dry. That's why we use humidifier air just like this time to keep the air moist and comfortable. In conclusion, tracheostomy care might sound complicated at first, but it's really just about keeping things clean, comfortable, and watching out for a problem. With the right care, people with tracheostomy can continue to breathe easily and live a full life. So this is my end of my discussions. Thank you for listening to me today. That's all.